I certainly think that in my experience at the Tourette service at Great Ormond Street Hospital, that, we were experiencing the stress and frustrations from families, saying exactly what Maddie and Shonik have been describing in terms of being bounced between pediatrics or child mental health and really struggling to find the support that they needed for tics and Tourette's. When they eventually came to our service, of course, there was also the additional difficulty of finding a service that was supposed to be designed for tics, but many of the children that we saw had additional neurodevelopmental difficulties. And we were very fortunate at Gosh to have the resources to be able to diagnose ADHD and autism if we saw it, but to know that that's not universally available. But those co-occurring conditions are so common in Tourette's, and it makes no sense really for families who've already been bounced around to then be told to go back to another waiting list for ADHD or another waiting list for autism when we know that conditions so frequently co-occur. So I think there is something to be thought about in terms of how services are commissioned, because I feel at the moment that there's a lot of silo working. So specific services for ADHD, specific services for autism, specific services for tics and Tourette's. And in an ideal world, services should be developed for the needs of the child, whatever they are. So if you happen to see a clinician, they should be able to evaluate your mental health needs comprehensively. And I'm sure that this would ease the patient journeys for families.